Hi, I'm Dr. Mark from Noonan Family Dental. I'm here to talk about the most searched questions about Invisalign or aligners. Is Invisalign better than braces? Invisalign in general is not necessarily better than braces. Each have their own unique situation. So with Invisalign, generally we would recommend for patients that's more a mild to moderate case. In more severe cases, we still go for the traditional braces. Is Invisalign truly invisible? I would say it is pretty much invisible because in a way that a lot of my patients tell me that even their closest friends oftentimes do not even realize that they're wearing the Invisalign. My Invisalign doctor mentioned that I need attachments for my teeth. So what are they? Why are they necessary? So attachments are basically white filling material that we put on the surface of your teeth. This is in order to help direct the movement of your teeth to make your treatment a lot quicker. What should I do prior to getting my Invisalign? Before you come in for Invisalign treatment, we definitely do recommend you to come in for a full examination and clean. We need to make sure that you do not have any problems with your teeth. If you require any sort of fillings or extractions, it needs to be done first. Why is this important? It's because prior to Invisalign, if your decay is not treated, it can get worse during treatment. So we need to make sure that your teeth is in a healthy state before we proceed. It is also very important for us to get all the relevant X-ray records. This way, we can plan out your case accordingly and make sure that there's no hidden decay or problems in between your teeth. At the end of the examination, we'll present you with all the treatment options and quotes. This way, you'll know exactly what you're up for, and then you can make your own decisions. What disqualifies you from getting Invisalign? I would say in general, Invisalign is suitable for people around the age of about 16 or above. Just because under 16, the children are still growing and compliance could be an issue. Or complex cases such as very severe crowding or open bite issues, or if you have jaw issues, then we will still recommend the traditional braces. We still believe that traditional braces is the gold standard and it will do a slightly better job compared to Invisalign in general. How long does the treatment usually last? So usually the treatment for Invisalign or aligners, they last anywhere from 6 to 18 months, depending on the complexity of the case. Generally, we will bring you back every 4 to 6 weeks just to monitor your progress and making sure that everything is progressing smoothly. What is the shortest amount of time to wear Invisalign? Generally, we'll say the shortest amount of time is about at least 4 to 6 months. So generally, if you wear for 4 to 6 months, it is just for very minor corrections. For example, just some relapse cases, meaning that you had braces done before and it has just moved out of place and you just want to bring it back to that straightness once again. Other times, you may have just this one stubborn tooth that just looks a little bit turned or just a little bit out of line. Then Invisalign can do just a 4 to 6 months treatment and that could make your teeth nice and aligned again. So when you come in for an Invisalign consultation, we cannot tell you the exact time frame straight away. Normally in that appointment, what we do is that we will take some photos and scan of your teeth. Once we scan your teeth, we will be able to visualize it in a 3D version. From the 3D version, then we'll be able to show you a simulation. From that, we will be able to estimate the approximate time frame for your treatment. If I feel that my teeth are straight enough, can I stop the Invisalign treatment? So in general, we do not recommend you to stop your treatment halfway. Just because teeth may appear straight to you, the actual alignment or how your teeth comes together may not actually be balanced yet. Your teeth may move a lot easier or relapse over the years. So we definitely suggest if you're gonna stop your treatment midway, talk to your dentist and ask for their opinion. How painful is Invisalign treatment? So oftentimes I tell my patients that Invisalign isn't actually painful. What Invisalign does, it actually gently and slowly moves your teeth over time. Although it's not painful, it can be a little bit uncomfortable. You will feel a little bit of discomfort from that pushing sensation. So the more movement that's required, it is slightly more uncomfortable because Invisalign, we will only perform on mild to moderate cases. So generally, Invisalign is quite comfortable. I'm experiencing pain or discomfort while wearing my aligners. What should I do? Initially, when you wear it for the first 2 or 3 days, it would be uncomfortable, but we're not talking about anything severe pain though. So if you're feeling very severe pain, however, please call your dentist straight away. Do you sleep with Invisalign? So we definitely encourage you to sleep with Invisalign. As we mentioned before, that with Invisalign, you do have to wear it for around 22 hours a day. You have to wear it all the time, except when you're eating and brushing your teeth. Well, aligners affect my speech. When you wear the aligners, it will affect your speech slightly. It tends to give you a little bit of a lisp. If you just go home and you practice speaking in front of the mirror, just a couple times a day, over about a 2-week period, the lisp should disappear. Can I drink alcohol or smoke while wearing my Invisalign aligners? The answer is yes, you can. However, with smoking, it can cause brown or yellowish staining on your aligner, which can cause your aligner to look less aesthetic. In terms of drinking with Invisalign, you do need to watch out for drinks that stain your teeth. For example, like coffee or red wine, your aligners may become of a brownish stain, so it may not look as invisible as you want. What if my Invisalign or attachments have turned yellow? You could use professional bleaching solution, which would help whiten those areas. However, it may not be able to bring to its original transparency or whiteness. So if it is your aligner that has turned yellow and you're unhappy with the color, the good news is you do swap a new aligner after every 2 weeks. In regards to your attachment turning yellow, that's a little bit more difficult. Generally, with the whitening product, may whiten the attachment slightly. However, if you're still not happy with the color of the aligners, then the dentist may have to make new attachments for you. It will definitely delay your treatment and can have additional costs. How often should I change my aligners? With all different aligner treatments, even Invisalign, you will change a new set of aligners every 2 weeks. What if I lost my aligner? The funny thing is, I actually have patients who lost their aligner even on the first day. So the minute they left, 2 hours later, they said it fell off their pocket. It can happen, definitely. We generally say, please keep your aligner in a very safe place, okay? Especially if you had to take it out for eating. We'll give you a special box for you to put your aligners for safekeeping. If you really lose your aligners though, please put back the previous aligner from the previous set so that at least your teeth do not move while we order your new set of aligner. Ordering you a new aligner may have additional costs involved in it. So please be careful with your aligners. How much does Invisalign cost? With Invisalign, it's actually a very big range. It ranges from anywhere from $4,000, sometimes to $7,000. It all depends on how difficult the Invisalign case is. Generally, we are able to know quite a very close estimate of the total cost once we have the simulation of your teeth. This way, we know approximately how long it takes to finish your treatment. Is Invisalign worth it? I would say most of my clients are actually very happy with the result from Invisalign because it is quick, it is quite simple, and it looks great. Another advantage of Invisalign is that it requires no metal brackets and wires. Because usually the metal brackets causes irritation and ulcers to the lip or the gums. So with Invisalign, it's actually a much more comfortable process. Also, Invisalign requires lesser appointments compared to the traditional braces. If you are someone who is busy with your schedule, Invisalign will actually save you some time. Once again, I'm Dr. Mark from Noonan Family Dental. Thank you for watching this video. I'm trying to put out a new video every week, so please like, comment, and subscribe to our channel.